Attention Deficit Hyperactivity Disorder, or ADHD, has long been associated with children and teenagers, but it's not just a problem for kids. Roughly 11 million adults in the United States are impacted by the condition, and many of them don't even know they have it or aren't getting treated for it. Today, we'll hear from adults who are living with the condition, and leading experts will share their insights and the latest information on another kind of treatment for adult ADHD. I'm Beth Troutman. Access Health starts right now. ADHD is now recognized as one of the most common neurobehavioral disorders. The exact cause is unknown, and its presence is not always easy to spot. But it is often diagnosed based on persistent patterns of inattention, hyperactivity, and/or impulsivity that interfere with functioning or development. It is also not just a childhood disorder. 90% of individuals diagnosed with ADHD during childhood continue to experience difficulties associated with the condition throughout their lives. Now, I don't know about you, but I have a lot of questions. And thankfully, we have Dr. Greg Mattingly with us. He is an associate clinical professor at Washington University School of Medicine and is board certified in adult and adolescent psychiatry. Welcome to the show. Thank you so much for joining us.
Great to be here with you.
Let's talk first about the people who are diagnosed with ADHD in childhood. Do they usually grow out of it, or is it something that follows them into adulthood?
You know, one of the common myths of ADHD is that you're going to grow out of it. We know that's not the case. As you said, 90% of kids with ADHD, 90% will continue to have symptoms into adulthood, but those symptoms change. A lot of my adults, they may have gotten missed when they were younger. And now all of a sudden they're trying to raise their kids, they're trying to parent, and they realize I get distracted, I have difficulties with time management, I have a hard time, I start a project, I don't finish it, and I just can't keep the balls in the air anymore.
Well, let's talk a little bit more about that in detail. If there's someone watching today saying, oh my gosh, that just might be me, let's go into detail about what some of these symptoms might look like in adulthood versus that childhood symptom that people seem to pick up on.
So, difficulties with time management, hyper-focused on things that I do find interesting, but I can't let those things go and shift on to things that I should be paying attention to.
This must have a huge impact on relationships, on family dynamics, if you're dealing with some of these symptoms.
ADHD does not discriminate. So I see people of all different walks with ADHD. In a relationship, a lot of times I'll hear a wife come in and say, listen, I feel like my husband doesn't pay attention to me. He's distracted by all these other things. He can sit and do this or do that all day long. But when it comes to engaging and parenting and paying bills, he's just not a part. He gets distracted by things. The flip side is, I'll have a lot of women come in and say, Dr. Mattingly, I don't mean to get overwhelmed. I don't mean to get frustrated. I don't mean to not wrap things up. But my brain gets distracted by things. I just feel like it's always going inside. And one of the things we haven't talked about is many of my adults have found ways to kind of compensate and cope. But it takes a lot of energy. So having to find ways to compensate within your life that help to make you successful, but burn a lot of energy, a lot of time, and a lot of cognitive capital with all of those coping skills.
So what do the statistics tell us about adult ADHD in men versus women?
So what we know is that it's more common boys versus girls, but by the time you get to be an adult, the numbers are even. Men and women are exactly the same in adulthood, and more women come in for treatment than men when it comes in for a diagnosis of adult ADHD.
Now, we're going to talk about that a little bit more in just a minute, but first, let's meet Michelle.
I always knew that I struggled in school as a child, and then as an adult, there were certain things that I struggled with focus-wise in a job. In college, I would procrastinate a ton on projects. As an adult, having a family and a house, I always procrastinated on things getting done at home. I had still Christmas decorations, and it was August. I have so many projects laying all over the house because I could never quite get them done. Well, it wasn't until we decided to get help for my son, who was diagnosed with ADHD when he was 10, that I realized that we have so many similarities that perhaps I had ADHD. We were at an appointment with our psychiatrist, and I asked him, I said, what are the chances that this ADHD is genetic? And so he said, well, do you think you have ADHD? And I said, oh no, I know I have ADHD.
Welcome back, everybody. We're here with Dr. Mattingly. We're going to pick up our conversation now. I read that according to the American Psychological Association, many women are in their late 30s or early 40s before they are diagnosed with ADHD. I want to know, is that something that you're seeing in your practice, like what we saw in Michelle's story?
Michelle echoes exactly what we see every day. So I would say the average age of women that come in to see me probably is late 20s through mid 30s. That's a very common presentation.
Once you have screened a patient, how is adult ADHD then diagnosed?
So we have some rating scales that measure your symptoms. We measure all 18 of those symptoms that make the diagnosis of ADHD, and we look to see which ones are severe and causing problems in your life. So we diagnose it, we make sure we rate it, and we want to measure how you're doing as we treat those symptoms.
Let's talk about that. How do you approach treatment of adult ADHD?
So treatment is not just a one-size-fits-all. You know, it's bringing in important psychotherapy. Psychotherapy for maybe you within your relationship with your spouse. How are you doing as a parent? How are you doing with just self-esteem therapy? You know, ADHD can do a number on people's self-esteem where they start feeling just worn down over time. It's addressing what's going on in your life, incorporating the treatment with medicines when medicines are needed, and make sure you get the right treatment for your patients.
Thank you so much for joining us today. You have been just a wealth of information and have enlightened us all. We appreciate it.
Great to be here.
Coming up, the treatment complexities of adult ADHD. We'll be right back. ADHD in adults is considered a chronic and debilitating disorder and is known to impact people in many aspects of their lives, including professionally, relationships, and even daily functioning. Dr. Burjit Aman is a psychiatrist specializing in child, adolescent, and adult behavioral therapy.
At the Behavioral Medical Center, we see patients of all ages, and we treat all conditions, but I treat a lot of ADHD really across the lifespan. Medications can help a lot of a patient's ADHD symptoms, but in order to really function optimally, they really need to also have behavioral therapy. An ADHD patient can benefit from having a certified ADHD coach. These are people that can teach them tips and strategies so that they can modify accordingly. They also need to be very mindful of things like diet, good nutrition, exercise, good rest is really critical. All of these things together are what's going to help them do their best day in and day out. So behavioral therapy and medications complement each other.
I was first diagnosed with ADHD at 30 years old. I always felt like I had symptoms of ADHD. I was distracted a lot. I had a hard time reading and comprehending things. I struggled through school a lot, especially in long tests. I was a straight A student in school, somehow managed to be able to do that with my ADHD symptoms being untreated, but I had to work 10 times harder than anyone else did to be able to keep my straight A average. When I didn't buckle in my son on the way to the babysitter one day, I realized that it wasn't just affecting me anymore, that it was affecting my ability to take care of my family. I went to a psychiatrist and had a great conversation back and forth discussing what my childhood was like, what kind of symptoms that I experienced, and it was very obvious that it was something that I had dealt with my whole life. I was the loud, quirky girl that was random and interrupted others, and I had a hard time staying focused. I had a hard time making friends and keeping friends because they thought I was a little crazy sometimes. Into adult life, I had a lot of trouble organizing. I call it organized chaos because I know exactly where everything is in the pile. I can tell you the paperclip is sitting next to the table and the floor, but somebody else would look at it and say it was a disaster. When I was given my ADHD diagnosis, it was a relief because it was something that I felt like I always had, and then maybe I was in a little bit of a denial of how bad it was.
As we've been discussing today, the combination of behavioral management techniques and medications remain a foundation of treatment.
When I start to talk to a patient about using a medication, the first thing we talk about is, what are we even trying to accomplish? What is this thing called ADHD? I talk to patients about the fact that they're likely having difficulty with 3 core areas: inattention, hyperactivity, impulsivity. It's not that by giving them a medication, I'm going to take away all their ADHD and they're going to have 0 inattention. It's normal to have some inattention. So we're trying to normalize those symptoms and help them function the best way that they can. We know that it may not be the first medicine that we're working with. So it may take another medication trial, or maybe even a 3rd one. And sometimes that can feel a little discouraging, but it doesn't need to be. And ultimately, ADHD treatments have been studied for nearly a century, and 75 to 90% of the time, we're able to find a medication that works well for them. We have both stimulants and non-stimulants for the treatment of ADHD. Stimulants go into the system typically within an hour, and they go out of the system after a handful of hours. A non-stimulant is a medication that you take once or twice a day, depending on the medication, and as you take it every day, it builds up in your system for all-day coverage. For example, I've been able to treat many adult ADHD patients with Qelbree.
Once-a-day Qelbree is a non-stimulant prescription medicine used to treat ADHD in adults and children 6 years and older. Pay close attention to changes in your or your child's mood, behavior, thoughts, or feelings, especially within the first few months of treatment, or when the dose has changed, as medications like Qelbree may increase the risk of suicidal thoughts or behaviors in some adults or children. You or your child should not take Qelbree with or within 14 days of taking a medicine for depression called a monoamine oxidase inhibitor, MAOI. Qelbree can increase blood pressure and heart rate. Your doctor will monitor these vital signs.
When I found out I had ADHD, I was relieved, I was sad, I was excited, all at the same time. I was sad because I had struggled my entire life as a student, relief because I knew I had ADHD, and then excitement because I knew what success my own ADHD son has been able to have on Qelbree, that I knew that there was so many possibilities for myself. I knew there was hope, that I didn't have to sit and struggle on a daily basis with things that needed to be done, because I saw my son's success that he had on his medication, and I knew we were very similar as children growing up. Now that I've been on Qelbree for a year now, I just feel like I'm more self-aware. Being on Qelbree and being a mom of 3, it has helped me stay organized, focus more on their needs, be motivated to do the tasks that I need to do as a mom to help them be successful. If I had to pick one word to describe ADHD, it would be cloud. When I started Qelbree, the cloud lifted. I could have a single thought, not like 20 at the same time. Things were clear. The sun came out.
The initial treatment that I started with was a stimulant medication. It just wasn't covering everything that I needed for an ADHD treatment. I struggled with early in the morning and late in the afternoon, which often was difficult with a toddler and the day-to-day struggles with life. And so I discussed with my psychiatrist if there was another option that maybe lasted a little bit longer for the day, and that was when Qelbree was brought up. So I started seeing results in about the first 2 to 3 weeks of initiating Qelbree. It's been a medication that I'm able to be compliant with because I can take it at night. It covers me for the full 24 hours, so I don't have to worry about when I'm going to be able to have medication coverage. Qelbree gives me consistency on a day-to-day basis. And being able to balance getting out the door in the morning, having everything, and not having to go back and forth in my car 15 times forgetting things. If I had to go back and talk to my younger self that struggled, I would tell her that things can get better and to keep pushing through everything, and that you're the way you are for a reason and you will love yourself.
Special thanks to all of our guests today. And if you'd like more information on adult ADHD or the treatment discussed today, go to Qelbree.com. And you can visit our website, accesshealth.tv. See you next time.
Indication: Qelbree Viloxazine Extended-Release Capsules is a prescription medicine used to treat ADHD in adults and children 6 years and older. Important safety information: Qelbree may increase suicidal thoughts and actions in children and adults with ADHD, especially within the first few months of treatment or when the dose is changed. Tell your doctor if you or your child have, or if there is a family history of suicidal thoughts or actions before starting Qelbree. Monitor your or your child's moods, behaviors, thoughts, and feelings during treatment with Qelbree. Report any new or sudden changes in these symptoms right away. You should not take Qelbree if you or your child take a medicine for depression called a monoamine oxidase inhibitor, MAOI, or have stopped taking an MAOI in the past 14 days. Also, you or your child should avoid olozatran, duloxetine, ramelteon, tesmelteon, tizanidine, and theophylline. Qelbree can increase blood pressure and heart rate. Your or your child's doctor will monitor these vital signs. Qelbree may cause manic episodes in patients with bipolar disorder. Tell your doctor if you or your child show any signs of mania. Do not drive or operate heavy machinery until you know how Qelbree will affect you or your child. Qelbree may cause you or your child to feel sleepy or tired. The most common side effects of Qelbree in patients 6 to 17 years are sleepiness, not feeling hungry, feeling tired, nausea, vomiting, trouble sleeping, and irritability. And in adults, insomnia, headache, sleepiness, tiredness, nausea, decreased appetite, dry mouth, and constipation. These are not all the possible side effects of Qelbree. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.